I've been in treatment before. I had a counselor over there that I was really close with, had a lot of respect for her, and she actually went through this program. And after I relapsed, after I got out of there, I called her and she had nothing but good things to say about this place, and I took her on her word, and I'm glad I did. This last time, after I relapsed, I was getting out of jail, and I had to make a decision until I die or something worse, or come to treatment, and I made that call and I came here. I looked up the program online. I saw the houses. I read about it, read about what they do here, and their approach is a lot different than my last rehab was. Here I learned a lot more about how I look at things and my behaviors. My last program was a lot more 12-step based, which was good, but here I really got to like the deeper roots of why I used, and it challenged my way of thinking, and yeah. I got to a house in Laguna Niguel. It was a really nice house. I couldn't believe I was in rehab, actually. And I got there. I was welcomed by the house manager. They took care of me. My housemates were really good at welcoming me, and I felt comfortable right away. My house was in Laguna Niguel. There's 11 people in my house. I had a roommate, and we all have our responsibility, take our part in taking care of the house and its upkeep. Each person is assigned chores. We all have to participate, and we had a good sized backyard that we all can hang out in. There's definitely more than enough room for all of us. There's always food in the house. We're never short on that, and it's definitely a comfortable place to be. I was really fortunate to have a really good therapist. I've seen therapists my whole life, ever since I was in like first grade, and I never really enjoyed it. I never thought it worked, and like I said, I was very fortunate to have a really good therapist here. She really challenged me and my thought process and how I handle situations, how I look at things. I'm really black and white with a lot of things, and in the short amount of time that I was here, I've really tried to work on that, and she's helped me through that. There's a lot of the staff members here that we know who cares about us. We know when people are, as drug addicts, we know when people are like faking it and not, and we definitely felt supported here, and I can speak for a lot of the other clients, and they would agree with me that there's a lot of great staff members here. We wake up usually around 6, get up, make our bed, do our chores, eat breakfast, get ready for the day. In the morning we go to the beach for about half hour, 45 minutes. We were able to play basketball, get ready for the day, walk on the beach. And then we take a ride, we come to the center. We have groups all day, from I think 9:30 to about 3:30, 15-minute breaks. We have an hour for lunch. Lunch is provided for us. After the groups, we come home, relax. Dinner is made for us. We have time to hang out, unwind. At night, we go to meetings most nights of the week. We have time, squeezing in like activities. A lot of houses go to the beach, play basketball. Depends on with your house manager, and yeah. Definitely the staff and a lot of the clients. That will make or break it for me. The staff members have gone above and beyond to help me, more than I could ever ask for, and I didn't even accept it at first, but they really went out of their way to make sure I had everything I needed and really prepared me for my discharge coming up, and and I haven't had that before. My last treatment center didn't provide that at all, and they really set a plan in motion for me and helped me get into school. I'm starting school this summer. At my last rehab, I really wasn't prepared to leave. I knew I wasn't, but I was forced to, and eventually I did relapse. But here I feel a lot more ready this time around, and I built a solid plan for when I get out of here. And the staff members really pushed me and challenged me to not just make impulsive decisions and have a really solid plan set in motion. And I'm going back to school. I'm going to get my KDAC. I want to be a counselor and help them like they helped me, because I couldn't have done it without them. If the staff members, if it was different staff members here, I wouldn't be like as confident as I am right now about leaving. If you're considering this place, it's definitely a great treatment center. There's a lot of programs out there that it's strictly a business, and they're just there to make money. But here, like, you feel the love and support that a lot of us need, because at other places they really, like I was saying, they don't really care, and here, like, the staff members show that they care, and we know that they care, and they help us every day improve ourselves.